Hello, everyone, and welcome to the Board of Health meeting of September 21st, 2020. Please note that this meeting is being recorded and will be available shortly hereafter for scheduled and on-demand viewing on any smartphone or tablet device. If anyone else is recording the meeting, please notify the chairman. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 30A, Section 18, and the Governor's March 15, 2020 order imposing strict limitations on the number of people that may gather in one place, this meeting of the Chatham Board of Health is being conducted via remote participation. No in-person attendance of members of the public is permitted, but every effort will be made to ensure that the public can adequately access the proceedings as provided for in the order. A reminder that persons who would like to listen to this meeting while in progress may do so by calling the number previously posted and on the screen. The call-in number is 1-508-945-4410, and the conference ID number is 976-370-749#. Now I'll turn it over to Chairman Beckley.
Thank you, Judy. I'd like to establish a quorum first. When I call your name, please indicate whether you're on the call. Dr. Noble Hanson.
Present.
Ron Broman.
Yeah.
Ed Sheehan.
Yeah.
And I'm on the call. So we have 4 members of the Board of Health on the call to begin the meeting. Later in the meeting, when we get to the COVID-19 section, we're going to welcome in Dr. Alan Ward as our 5th Board of Health member. So why don't we go ahead and start the agenda? We have 2 hearings and then 2 remaining issues. So starting with the first hearing, which is a variance hearing and approval of IA technology for Windy Hill Way, 5 Windy Hill Way Trust, Clark Engineering. David, Clark, are you on the call?
David, yes, I am. Can you hear me?
Yes, we can.
Okay, great. David Clark on Clark Engineering on behalf of Bob Moss. What he's proposing is an upgrade of the septic system to 5 bedrooms with an IA system. Currently, there's a 4-bedroom house located on the property. There's no addition involved. There is a storage room on the 2nd floor above, on the east side of the building that has windows, but it's unfinished, and he would like to finish it off as the 5th bedroom. So we show a new system with IA under the driveway on the requisite reserve area down the southeast corner of the property. As always, a 5-bedroom system with IA technology introduces less nutrients into the environment than a 4-bedroom without. Be happy to answer any questions.
Okay. Where are the absorption trenches in relation to the garage?
They're right in the lower area where you turn into the garage. So there's the 3 dark lines on the plan, and it says 15 feet plus or minus to the garage.
Okay, so the garage is to the left there.
Yes. Yep.
Okay. All right. Any other questions for David on this application?
What's going to happen to the catch basin?
It's going to be removed. It's going to be removed. It's a gravel driveway, and it's never been really used, according to the owner. Because it's gravel and it's all sand underneath, he has never seen water accumulate in that driveway. So it really isn't needed.
Okay.
So it's going to be a waste.
Yes.
Okay.
So David, this is Judy. The driveway is going to remain gravel?
Yes.
Okay.
Yes.
And I see that it's vented and The trenches will be H20 loaded for driving on.
Yes, yep. Yeah, they're Cultex, in the 180, Cultex only come in H20 now, from what I've been told, so
Okay. Thank you.
you're welcome.
Is the reserve area as needed?
It's the requisite size, yes.
Okay. That's all I have.
It seems to me that the design is straightforward and it does accomplish their objective of adding the fifth bedroom over the garage. And I'm fine with the proposal.
This is Noble. I'm all set.
I
Ron
go-
Roman, I'm all set.
Can I get a motion to approve the application?
This is Noble. I make a motion to approve the application, and perhaps Judy could read the conditions.
Judy?
Sure. So the conditions are that the applicant should restrict the property to a maximum of 5 bedrooms and record this restriction on the deed at the Barnstable County Registry of Deeds. Throughout the life of the system, it shall be under an operation and maintenance agreement. The operation and maintenance agreement shall be for at least 1 year and may be with any mass certified operator of the appropriate grade that has received training by the company on the operation of the system. Effluent from the system shall be monitored at least twice per year for the first 2 years, preferably in May and October. The effluent shall be field tested for visual examination of effluent turbidity solids, effluent pH, dissolved oxygen, and an additional lab test for the effluent for total nitrogen to meet the performance standard of 19 milligrams per liter, collected and analyzed by a certified lab. Water meter readings are also to be provided with the semi-annual report. Excuse me. After the required 2 years testing, application can be made to the board or their agent for review and possible modification of the monitoring requirements. The applicant shall sign a covenant with the board agreeing to comply at such time as the town of Chatham, through its Board of Health and Board of Water and Sewer Commissions, directs the connection of this property to the municipal sewer system should it become available. And the covenant shall be recorded at the Barnstable County Registry of Deeds. The applicant shall agree to apply a minimum of 6 inches of compacted topsoil to all landscaped areas of the property. The engineer shall submit an engineered as-built plan, including as-built elevations with the written certification that the system has been installed in accordance with the approved plan. No alteration of the floor plan of the dwelling will be allowed without further review by the Board of Health or its agent. And this variance would be granted pursuant to the State Environmental Code Title V, and the Town of Chatham subsurface sewage disposal is valid for 1 year from the date of the Board of Health approval. A permit must be issued and work commenced during that 1 year period, or the variance shall expire.
Thank you, Judy. I don't know, did we ever get a second to Noble's motion?
Second.
Okay, we have a second from Ron. Anybody from the public wish to comment on this motion before the board votes? Hearing none. Or any further discussion by Board of Health members on the motion? Hearing none. When I call your name, please indicate how you vote on the motion. Dr. Hanson?
To approve.
Ron Broman?
Approve.
Ed Sheehan?
Approve.
And I vote approve. So it's 4-0. Motion is approved and the application is approved.
Thank you very much.
You're welcome, David. All right, that's the first item. The second item is another variance hearing and approval of IA Technology for John Nyquist at 41 Patterson Road. We have the same engineering firm, Clark Engineering, representing the applicant. Dave, do you want to introduce
Yes,
this one?
David Clark for the record, Clark Engineering, on behalf of Mr. Nyquist. Mr. Nyquist purchased this property in the early summer, late spring. It's on cesspools, and as the buyer, he took on the responsibility of upgrading the cesspools to Title V. It is currently a 2-bedroom cottage. He is renovating it right now, but it will remain a 2-bedroom cottage. But because he has to upgrade the system, he is asking for a little departure from the Board of Health's normal variance requests, in that your local regulation does not allow a homeowner to put in a larger septic system than the number of bedrooms on the property. So he wants to put in a 3-bedroom system because he intends within the next 10 years to demolish the house and build a 3-bedroom house. So he'd rather only put in one septic system now and instead of digging up the yard again in the future. So there's 2 ways the Board of Health can grant this variance. One is from your regulation that doesn't allow oversizing the system, or alternatively, the Board of Health can grant a variance for the extra bedroom with the IA technology. The idea is he only wants to build a leach field once. So that would be my presentation.
How do we get from 2 to 4?
No, it should be only 3. I'm sorry. If it says 4, that is a mistake on my part. We're only asking for 1 additional bedroom, which is the maximum the Board of Health will allow.
Yeah, I thought
John,
I saw.
I think that's my mistake on the,
Okay, I did see 4. I did see
yeah,
4 somewhere.
that's a typo on the 3rd paragraph down there. It should be 3rd bedroom.
Okay.
Can I just make a comment?
Yes.
I think that my opinion on this is that the board could go ahead and approve this over design, but when they do want to come back, they would have to come back in at the time that they're going to rebuild and add the 3rd bedroom. At that point, they would put the IA system in, and as David said, they wouldn't have to tear up the leach field. They would already have it there, but they would be able to just utilize the fast ready tank that he's proposing today. So I think it makes a lot of sense.
That would be fine with us.
So they would install a tank to support the fast ready IA
Correct.
technology, along with a 3-bedroom tank and field now.
Correct.
That is correct.
And then, but after they did that, they'd still have a 2-bedroom occupancy, right?
Correct.
And not until they come back at a later date with a request to add a 3rd bedroom and a willingness to install the balance of the IA technology would we approve the 3rd and final bedroom.
Correct.
So that's okay. Now, Judy, why do we have a rule that says you can't voluntarily over-design in a system?
I believe that was done when we were doing working on our nitrogen loading regulations back in the early 2000s in order to keep people from over-designing or overbuilding their property. It's kind of a holdover. And now with the sewer system and the nitrogen loading regulations, it really isn't a big deal anymore, but we still have it in our regulations. So if you built a 2-bedroom house, you'd only have a 2-bedroom system. You couldn't in the future all of a sudden say, well, I have a 3rd bedroom, or if you had finished something off and we didn't know about it. So this way it just keeps people, it was keeping people limited to the number of bedrooms that they had by keeping their septic system sized accordingly.
Okay.
If that makes sense.
Any board members have any questions for Judy or for the applicant? I mean, for David Clark? I think I understand now. I was confused by the 4th bedroom reference, so that's been cleared up.
This is Noble. Judy, have we given a variance before for overbuilding of the septic, or is this like a new precedent, or is this something we've done before?
We've done it before, I believe. It's especially what we would do is deed restrict the property, and when they go to get a building permit, we would know that they can't go any higher than 3 and that they already have the system sized for it. So it has been done in the past.
Okay.
Any other questions? Can we have a motion to approve?
Yeah, this is Noble. I make a motion to approve the application, and perhaps Judy can read the conditions.
So the conditions would be the applicant should restrict the property to a maximum of 3 bedrooms and record the restriction at the Registry of Deeds, and submit a copy of the executed deed to the board. The applicant shall return to the board when changes to the dwelling are proposed prior to applying for a building permit for approval of the 3rd bedroom and the IA septic system. The engineer shall submit an engineered as-built plan, including as-built elevations with written certification that the system has been installed in accordance with the approved plan.
The other conditions relating to the IA would come forward at the time they get approval for that, true?
Correct.
Okay. So we have a motion. Can I get a second on the table?
Second.
Was that, oh, that was Ron. Okay. Any further discussion by board members? Any member from the public wish to comment on the application? Hearing none, I'll call the question. When I call your name, please indicate how you vote on the motion. Dr. Hanson?
To approve?
Ron Broman?
Approve.
Ed Sheehan?
No.
And I vote to approve. So it's 3-1, motion is carried. And the
Thank you very much.
application is approved. You're welcome, David. All right. Item 3. Noble, could you comment on that?
Yeah, at the last meeting, I brought up whether we should remove the parking restriction at Schoolhouse Pond now that we're through the summer. And I did go down and visit it several times at the end of the week and over the weekend, and the weather wasn't very good, but obviously there's very few people using the beach now. So I would recommend that we remove the parking restrictions and ask Park and Recs Department to remove the concrete barriers. But we would leave up the signage on the grassy part and leave the signage up on Sam Ryder Road.
Okay. That makes sense to me. I don't know who, I guess we would make the motion or we would make the recommendation to Parks. Is that the way it would work?
I believe, yeah, this is Judy. That's what we could do, is make the recommendation to Parks and Rec.
Okay, because I remember Craig mentioned to us at our last meeting that they were having their own meeting, I think tomorrow. So if we can transmit to them, Judy, a note recommending that they, if they agree, proceed with asking DPW, or I don't know who does it, to remove those concrete barriers that are down there and restore the 16 spaces. That'd be great.
Yeah, I can do that, and we'll let the selectmen know as well that we've made that recommendation.
Perfect. Do we need to vote on this?
Is Noble. Yeah, I think we ought to vote. Actually, we put in the measure to cut the parking in half, but
Okay.
it's fine to vote on a recommendation that Park and Recs make the decision to, or the proposal to move it.
Okay. So Noble, why don't you make that motion?
Yeah, I make a motion to restore the full parking at the Schoolhouse Pond parking lot and remove the concrete barriers, but leave up the signage to not park on the grassy areas and leave up the signage on Sam Ryder Road as a recommendation to Park and Recs.
Perfect. Can I get a second to that?
Ed Sheehan.
Ed, okay. Any further discussion on this? I think it's a very good suggestion, Noble. Any comments from the public before we vote? Hearing none, when I call your name, please indicate your vote on this motion. Dr. Hanson,
To approve?
Ron Broman,
Approve.
Ed Sheehan,
Approve.
and I vote to approve. Okay, very good. Thank you, everyone. Now we get to item 4, but before we do that, I'd like to add to the roll call Dr. Alan Ward, who's an alternate member of our board. Alan, are you on the call? Remove your mute button.
Hi, John. This is Ryan Darman. Alan may need to press *6 on his phone to unmute it.
Okay. Did you copy that, Alan?
You got me now?
Is that you, Alan?
Yes.
Okay, good. You're on the call, and we're about to start a discussion of the final agenda item relating to COVID-19. So let the record reflect that we have an additional board member now on the call. Dr. Duncanson.
Yes, good afternoon, everybody. So let me give you a quick update on where we are with a number of COVID-19 related issues. So I'll just quickly run through the numbers. Right now, we are over 31.1 million cases worldwide. We have 962,000 deaths worldwide. In the United States, we are currently over 6.8 million, 6.8 million cases. And we are at just shy of 200,000 deaths in the United States. As we've talked about previously, the U.S. continues to lead the world in terms of the number of cases. India is now second, Brazil is third, and the U.S. continues to lead in number of deaths as well, unfortunately. And, you know, we continue to average around 25% of both worldwide cases and worldwide deaths. In Massachusetts, as of the numbers that just came out at 4 o'clock today, we are a little bit over 127,000 deaths.
Cases.
And we are at 127,000 cases, and we are at 9,317 deaths.
Okay.
In Barnstable County, we currently have 1,713 confirmed cases of COVID-19, and we have 172 probable and confirmed deaths from COVID-19. In Chatham, we have 33 confirmed cases, and just for clarity, that number goes all the way back to the beginning of the pandemic. So we've had 33 cumulative cases in Chatham since the beginning. And we are still only aware of 2 confirmed deaths of Chatham residents since the beginning. As I'm sure everybody has seen over the weekend, a couple of things have transpired. We did send out a press release yesterday, but late Friday afternoon, we were notified that a seasonal resident in Chatham returning from out of state had tested positive. There were a couple of implications for that. One, the individual is related to a member of the Chatham Fire Department and also had a granddaughter who attends the Monomoy school system. So the Monomoy school system has put their COVID response plan into effect. They are basically quarantining everybody. They've basically gone above and beyond the requirements of the state. And rather than just quarantining students that or teachers that were students and teachers that were in close proximity to that individual, so a close contact, they have gone ahead and they are quarantining all the students and faculty that were in a number of classes where this student attended. In addition to that, the family obviously is quarantining in accordance with the state and CDC guidelines. And then also Friday afternoon, we were notified that 2 seasonal employees of the Harbor Master's office also tested positive because they had attended an off-Cape non-work related event. So today we had testing for members of the Chatham Fire Department as well as members of the Harbor Master's office. And in a last minute request, we were also able to accommodate teachers from the Monomoy school system. So that testing took place this morning at the Chatham Fire Department in cooperation with Broadreach Healthcare, who provided the tests for us. Those tests have now been shipped out, and we anticipate having the test results back on Wednesday. We tested a total of 44 individuals through this morning's testing scenario. So I think that quickly brings you up to speed on where we are currently. And obviously we're going to have a discussion, and I'll be happy to answer any questions.
Bob, this is John. I sometimes get fuzzy with the implications of testing and finding that somebody is negative. For instance, if you had a teacher at the Monomoy school who was tested, and if that teacher had been included as a close contact, that teacher still has to remain in quarantine for the full 14 days. True?
Yes, that's correct. Anyone who's been identified as a close contact has to mandatory quarantine for 14 days, irregardless of the fact that they might get a negative test result sometime during that period.
Gotcha.
And the reason for that is the incubation period of the coronavirus. You know, you could run out tomorrow and get a test and have it come back negative, and then you could come down with symptoms in 3 or 4 days. So, you know, the state is being proactive, and so is CDC saying, if you're identified as a close contact, it's a mandatory 14 days, irregardless of any negative test result you may get during that period.
However, if the teachers that were tested were not within the identified close contact group and they get a negative, then they're back at school.
That's correct, yeah, because they were not identified as close contacts. And in this case, more than likely, they would not have been recommended for testing in the first place. You know, if there wasn't some reason to think that they might have been exposed, they wouldn't have been recommended for testing.
Okay. All right, thank you. Any other questions for Bob on his report?
Yeah, Ron Broman. Dr. Duncanson, have you seen anything that they expected to increase during the fall months?
You mean second wave, if you will?
Yeah, second wave. Yeah.
I think we all are anticipating a second wave. Because as the temperatures get colder, it drives more people indoors. And we all know that close contact is really the problem here. We've seen outbreaks on college campuses as they return to school, and then unfortunately some of the colleges then send those people home. So, and we've seen, evidence of a slacking off, if you will, of the recommendations to wear a mask, social distance, wash your hands. So, I think we're all concerned that we may see a second wave. And obviously the big concern is having that second wave of COVID hit at the same time as the flu takes hold. And basically getting the double whammy. That's why there's a lot of emphasis right now on getting people to get their flu shot, hopefully get it early. So we only have to deal with one increase in, respiratory disease at a time. But, I think we're all concerned about the second wave. There is evidence in some European countries of a second wave starting. So, I think it's out there. I think it's potentially realistic, and we'll just have to wait and see.
Thank you.
Thank you, Ron. I know. Go ahead.
It's Noble for Bob. Which test did they actually do on these people, and who paid for it?
The test that we obtained the test from the Broadreach Healthcare because they've set up a testing program. They're required under federal and state guidelines to test all their staff on a rotating basis every month. So they've set up an arrangement with a private testing lab. So we went to them. They were able to provide us with some tests. The town is paying for it, to test our town employees, and then Monomoy School District will be paying for the test that, we obtained for the teachers. It is going to be the rapid test. It's not an antibody test. It is not the full, nose swab PCR. It's one of the new saliva-based PCR tests.
Yeah, so it's the antigen test, the quicker one.
No, it's a regular PCR test.
Oh,
It's not
it is
an
a
antigen
PCR.
test. Yes.
Okay, which is the good one.
So
Yeah, it's the good one. It's not the nose swab, though. It's one that uses a saliva-based
but
sample.
it's a PCR, not an antigen.
Yes.
And it's so it's not that 15-minute test they can run.
Right. No, that's why we won't have the results back until Wednesday.
So how long does it take then? When were they collected?
They were collected this morning, and as I said, we should have the results back on Wednesday.
So that's like 48 to 72 hours?
Yeah, 48 hours is what they're telling us.
And what is the unit cost on that?
That I can't tell you right offhand because, we did make arrangements to get them through Broadreach.
Gotcha.
So I
Okay.
can't tell you the exact cost right now.
Okay.
Can I ask a question, Dr. Duncanson? Does their insurance pay for that? Or will the insurance pay for it?
Generally, insurance will not pay for it if you're asymptomatic or you don't have a doctor's order. In this case, the town's going to pay for it because these are town employees.
Yeah, I understand that. I just wondering if insurance would cover it at some point for people, anybody, so.
Yeah, generally insurance will cover it if you're symptomatic and you have a doctor's order to get one.
Okay,
If you're asymptomatic or don't have a doctor's order, then the insurance generally will not, and again, it somewhat depends on your insurance coverage as well.
Okay, thank you.
This is Noble. Bob, about how many active cases, COVID cases in Chatham do you think we have now?
Right now, I think we probably have about 5 active cases that we're actively, that are in quarantine periods, if you will. And some of those are not Chatham residents. but they are town employees.
Right. I think there was a lot of discussion, as we all know, recently at the Board of Selectmen meeting that we were part of. And I think my understanding is that the expectation was that the Board of Health would look into several of these issues and consider whether or not we were interested in promoting any new requirements. And I think one of those related to public disclosures. And Bob, clarify for me and the rest of the board that the present state recommendations, while they require that the restaurant owner report a newly identified case of COVID to the Board of Health or to the health department, there's no requirement now that that new case be disclosed to the public by either them or us.
Right. As far as I'm aware, based on my reading of the state's guidance for restaurants under phase 3, step 1, which is what we're currently in, it says if the employer is notified of a positive case at the workplace, the employer shall notify the local Board of Health in the city or town where the workplace is located. There's no indication that they have to notify the public. No requirement.
Okay. So that's a question that has come up, and I think we need to think about that, whether or not we feel as a board that the public should be notified whenever we get a newly identified case in a restaurant, a local restaurant, or local, or even, other food establishments. I'm not quite sure how we would define that, but what that would involve would be then when the Board of Health, when the Department of Health hears of a case, then that new report would be noted on the town website. And we would thereby be more transparent in terms of the community and the public to be aware that there was a newly described case involving a particular restaurant. And then that ties in then with another issue that relates to a question Ron Broman brought up about the fact that the restaurants are taking customer phone numbers when you go in. And part of the expectation, I think, among the public would be that if there was a newly identified positive case in that restaurant, that the patrons would get a call. And Bob made the comment, Bob, you did made the comment at that meeting that you don't, obviously there's no requirement that the restaurant notify, and we're not aware of them particularly doing it. So I would just like to hear the Board of Health members talk about or discuss the value or lack of value in one or both issues, namely one, requiring public disclosure of any newly reported COVID cases involving restaurants in town. And number two, whether we would have an interest in requiring those restaurants who identify new cases to call the patrons that were recently dining in that restaurant and let them know that they did have a positive case. Alternatively, you could say that by virtue of announcing it publicly, the public would know if, oh, there's a new case in restaurant A. Yeah, we just ate there yesterday, so, you know, I'm glad we know. And maybe they would be aware of taking special steps to monitor their health. But I don't know. So what do other board members think? Does any of this make sense?
This is Noble. Yeah, I agree that that we should publicly disclose a restaurant that has a COVID positive employee. The concern is whether that gets close to a HIPAA violation of some individual. I think the residents kind of would like that. That came out at the previous meetings. I think it trickles out somehow anyway. And, you know, the first you hear of it is, you know, an email from the Chronicle or from a friend. And I think it's better if it comes officially from the board. I would add, if we make it mandatory, because that is an extension of the state guidelines, but it's, you know, probably not excessive. But I would add or consider adding a caveat to it that it's disclosed publicly unless the health department feels that the disclosure might reveal an individual's status because of some special circumstance in the restaurant, or maybe it's a very small number of workers. So there's kind of an opt-out for the health department. I don't know how Bob and Judy would feel about that, but that gets us away from a broad mandatory public disclosure, which I think Attorney Costello kind of cautioned us about. And then I think that if we make it public through a press release or the website or whatever, I don't feel it's probably necessary to have the restaurant try to call all these different people and tell them. I think that information would be public in the public. I think that would be sufficient.
They would be duly notified by virtue of the publicity.
Yeah, I think so.
Okay. Bob, what's your reaction? And Judy, what's your reaction to this idea?
Hi, this is Judy. I think it would be acceptable to disclose that we had a case from a restaurant employee. You know, as Noble said, we need to be careful, you know, if there would be any way that person could be identified. We really need to be careful. It would depend on how large of an establishment it was, etc. So I think it'd be something that we would definitely want to run by our town council again, but I'm okay with the idea. Bob, I'm interested in hear what you think.
Yeah, I'm kind of siding with you, Judy. I don't see anything on the face of it that is problematic. You know, as I'm sure everybody knows, the names of several establishments over the course of the summer have been out there publicly, either by us or by the press. And frankly, Chatham's a small town, and it's amazing. Every time I see something, it amazes me how quickly the word gets out in this town. So, you know, but I think as you know, as you've stated, John, and as Judy reiterated, I think we just have to be careful that we don't run afoul of any particular HIPAA or other regulations. But I think, you know, just putting the name of the establishment out there, or them putting the name out, you know, we have had some instances where the establishment themselves has posted information on Facebook or their own website or wherever about this. You know, so it may, you know, the board may want to consider something where we don't, meaning the health department isn't the one that actually puts it out, but that onus is through a requirement on the restaurant or on the food establishment itself to put the word out. You know, yeah, I think that's all I've got at the moment.
And then the back to the HIPAA issue, for instance, in no case would a public disclosure reference even, the job responsibilities or the gender of the positive worker. So we don't need to know he or she's a bartender, or he or she is the waitress or the hostess or any of that. It would all simply be very generic in its in the nature of the report. Well,
This is Noble. Bob, do you think the opt-out, if the food establishment is very small, say it's a coffee place or a donut shop, has only 1 or 2 employees, that you have the ability to opt out of disclosing it publicly because it might come close to identifying an employee? Do you think that's necessary or not? Or helpful? I'd say helpful.
I like that idea in some respects, but at the same token, I don't want to get into a position where the public feels we're treating one group one way and somebody else differently.
It makes it a difficult call, so it's better.
Yeah, I think if you're going to do it, I think it's, the same for everybody. I think that's the only way to have confidence from the public side of it, if you will. And I mean, clearly that, that puts some more pressure on smaller establishments, obviously. I mean, I know in the past, pre-COVID, years ago, and I'm not saying this about Chatham, but I'm aware that it was done in other municipalities, and we may have done it in Chatham as well. When restaurants had to be closed because of food safety issues, obviously the proprietor or the manager was notified and told, hey, you guys have to close down because your temperatures aren't right or something along that line. They were somewhat given the option, we don't really care what you put on the front sign on the front door. You can say to the public, we're just closed because the owner's taking a break. You don't have to specify that the restaurant's closed because of a health violation. So there's always that concern about the impact on these places from a business side. And so there's always been, some thought that, if it can be mitigated in some way, that's a good thing. Obviously in this case, this is clearly a larger public health issue.
Yep.
So, I mean, I think as long as we're just saying this restaurant is closed for COVID-19 related issues, as John said, don't get into what the role of the person or whatever may have been, so that we don't get too specific. I don't see an issue on the face of it. I would want to confer with town council and just make sure that we're not going down a road that's inappropriate. But as I said, we've already had several establishments in Chatham that have closed, and they're publicly known very quickly.
So now we're touching the closure requirement, which is a 24-hour in the regs. It says minimum, I think, 24 hours requirement after a positive COVID case in a restaurant worker. It actually says patron too, or vendor. I didn't realize that until I really read it through. But if they get a positive patron in a restaurant, they're supposed to close and deep clean as well. So so Judy, how many restaurants, if we use the phrase restaurant to define the scope of this new requirement, how many restaurants do we have?
We kind of lump them all into food service establishments, and I think we've got about 125 or so, but that includes small liquor stores, markets, convenience stores, all the way up to grocery stores, large grocery stores. We only have one, and then restaurants. So, and then they're not all open all year round. So, I would say maybe 40 or 50.
So you have them separated by restaurant versus other types of food service establishments.
No, they're all lumped under food service. I'd have to do a breakdown to see,
Because-
actual sit in or takeout dining type restaurants, how many there are.
My point is, if we're going to take a look at doing this, we've got to define the scope of the public disclosure of a newly reported COVID case. And do we want to require it in all retail food establishment cases or only in the restaurant cases?
That's an interesting question because, really the restaurants where you actually go in and sit down are the ones that you would have presumably the largest exposure. So those may be the ones that we would want to focus on.
Versus, say, a takeout, like an ice cream shop, where you go in, you buy an ice cream cone and you leave.
Right, or a curbside takeout, or a grocery store where you're in and out in, 15 minutes or so. Yeah, we'd have to define what we're talking about here.
Could I ask a question? Or is it premature?
I think it's premature, Elaine. Let me, before we decide to do anything with this, Elaine, I promise you that we will invite public comment.
John?
Yeah.
This is Judy. Also, I know Mary Kavanaugh from the Chamber is on with us tonight. So she may want to, at some point, when you open it up, speak to this issue from the restaurants and the business point of view.
Okay, let me ask, any other Board of Health members want to wait at this time, or do we want to hear from the public before we decide whether we want to proceed with this?
This is Noble. Yeah, I'm wondering if we just don't make it food service business, because if you start parsing out, bakeries, some people sit down, coffee shops, some people sit down. It will get terribly, confusing. And then my other question would be, I guess you're going to deal with it in a moment, but can you make a motion for something and make it contingent on approval by the town council? Do we do that sometimes?
Or do we just request staff to check with and then report back? We could do it that way too, without a motion.
When would we vote on it, though?
Not now. I don't think, well, we could do it either way. I'd be open to.
So we wouldn't vote on it for 2 weeks. That's my point, though.
Right.
Yeah, I would say, if you're considering something like this, and I assume you would be doing it under an emergency regulation, you'd need to have some language in front of you to vote on. And, we haven't drafted anything up for you to consider yet in terms of specific language that, we could run by town council and get his feedback and all on. So I would think tonight it may just be, the board's direction that you want to have something drafted and reviewed by town council, and then you wouldn't take a vote until a future meeting.
Okay. I like that idea.
I do too.
Okay. If it's okay with the board members, I would like to open it up and hear what some of our guests might want to offer as additional points. Please be, reasonably brief in your comments so we don't get too far behind. Elaine Gibbs, I think you were the first one who had expressed an interest. Would you like to speak now?
Yes, thank you. I first had a question for Dr. Duncanson. I was a little confused with respect to the fire department and the Monomoy school system. I had originally heard that a student had tested positive, an 8th grader. Were you saying that it was a fire department person who tested positive and then the granddaughter was in the class, or were there two cases, the fire department member and a student?
Sorry, I had to unmute. No fire department member has tested positive.
So it's a student.
It was the firefighter's daughter and his mother-in-law, I believe it was, that were tested positive. So none of the firefighter that was involved originally has tested negative. And as I said, all the firefighters were tested today, but we won't know their results till Wednesday.
So, but originally it was reported that the student had tested positive. Is that not the case?
It actually started with the grandmother tested positive, who returned to Chatham from out of state. And then subsequent to that, we did learn that the student had tested positive.
Okay. All right. That was just for clarification. My understanding, when the Board of Selectmen referred this over to the Board of Health, it wasn't just regarding whether or not, we should be disclosing the name of a restaurant and or, the restaurant should be making phone calls. It was about the testing process. Should the Board of Health go beyond the guidelines of the state?
Yeah, we haven't gotten to that point, Elaine.
I thought that was supposed to be talked about tonight. That was the intent, I thought, because of the situation at the Squire. And
yeah, I'm planning to bring that up later.
Oh, all right. I thought this was the end of the meeting. Okay, then I will.
This is one issue that we wanted to get worked through first.
I would just say that I would hope you consider that as you're making the decisions, no one, I don't think anyone believes that HIPAA would be violated in terms of identifying a restaurant. But because it is a food establishment, I think the public's right to know transcends the restaurant not wanting people to know. And I'll talk about that more as you talk about the testing.
Okay.
But thank you.
Okay. Did Mary Kavanaugh wish to comment if you
Yep.
want to?
Mary's hand is up.
Okay, Mary.
Hey, John, thank you very much. So it's Mary Kavanaugh from the Chatham Chamber. And, I just wanted to say I haven't spoken directly to any of our restaurant members to get their feedback on this, like what they would be comfortable with, the requirements that are going to be put forth. But what I wanted to say was that if you would like the chamber to, put something out to our restaurant members, asking them, what they would be comfortable with as far as new regulations are concerned when they have a positive case, either amongst their employees or a patron, I can do that. So I wanted to let you know that going forward.
Okay.
If that's helpful.
Yeah, I have I guess my feeling here is the Board of Health should make its decision based upon what it thinks is appropriate for the protection of. I think we don't have any problem hearing back from restaurant owners. I mean, we would welcome that, but I don't think we want to frame it in a way that we are waiting to hear back from them before we decide what we might think is best.
Okay.
It's a subtle, but we welcome any input, I guess.
The other thing I wanted to share too, any press releases regarding these matters that we have received, we have shared on our website, which then automatically shares it to Facebook. So any press releases that we've received have gone out, just so that you know that information has been out there.
Okay. I think Bob Duncanson made a very apt point earlier, which is because Chatham is as small as it is, when there is a newly identified COVID case in a restaurant worker, the community hears about it anyhow. But I believe there ought to be a more procedural way, consistent way that is released through the health department, rather than wait for it to bubble through a press inquiry or what have you. So, but I'm still not settled on the scope of any new public disclosure requirement. Should it be restricted to sit-down restaurants? Or should it be broadened to all food establishments, retail food establishments? I think restaurants, if we limit it to restaurants, we're not going to have a problem of too few employees. Because I can't think, Judy, can you think of a restaurant we have in Chatham that may have like only 4 or 5 employees?
No, not really. I mean, even our coffee shops have a lot of employees, especially in the summer and the height of the season. So
I think if we drew this up in a way that it focused on restaurants, where I really think the greatest public concern would be, then we also at the same time protect against an inadvertent HIPAA problem, because the employer pool is greater in those formal restaurants. But if anybody else wants to make an alternate comment, I would certainly be all ears now to hear it. Yeah, go ahead.
So what I hear is that it would be public disclosure of a restaurant with a COVID-19 positive case by the town or the Board of Health, simply. And then we would tonight ask the health or the staff of the health department and the town council to review that and give us any further guidance.
I agree.
That would be kind of what I'd be proposing. And I think we would vote on that, would we? Is that how it works?
I guess so. Nova, why don't you just put that in the form of a motion, and then we can get a second and then decide whether to.
Okay, just say I'll make a motion that there is public disclosure of a restaurant with a COVID-19 positive case by the town or the Board of Health. And at this point, we give direction to the health department staff and the town council to give us further guidance on that motion.
And language.
And what?
And language, draft language.
Yeah.
All right, so that's in the form of a motion from Noble. Do we have another board member who's willing to make a second on that?
Second, Ed Sheehan.
Okay. Bob, are you okay with the way this is developing?
Yeah, that's fine. Yes, I have the sense of what the board wants. Judy and I will draft something up. We'll review it with town council and we'll bring it back to the board to your consideration and vote, and we'll publicize it, with Mary and all, so everybody's aware that you're going to take it under you're going to be taking a vote one way or the other. And, I think at that point, you may get more feedback from other members of the community on it.
Okay. Thank you. Does anybody from the public want to comment on this motion before the Board of Health votes on it? Okay, hearing none. Let me when I call your name, please indicate how you would vote on this motion. Dr. Hanson?
To approve?
Dr. Ward?
In favor.
Ron Broman? Unmute, Ron. Ed
Ron,
Sheehan? Ron, are you still there? Are you on the call?
if you're muted, you have to press *6.
Okay, let's skip over Ron for the time being. Ed Sheehan?
Yes.
And I vote yes. We have 4 votes to approve the motion that was made and seconded. And we'll exclude Ron's vote for right now. Okay, so that brings some closure, at least to that discussion about public disclosure of newly reported COVID cases. I'd now like to get to the other issue which came up and which Elaine Gibbs referenced a moment ago, which is what role should testing play in following up any investigations of COVID cases?
John, this is Noble. Can I just, before we get into that more lengthy discussion, can I just add 2 real quick things?
Sure, you have the floor.
Yeah, one is, and I think Bob clarified this, but it is mandatory for the restaurant to report to the BOH a positive COVID case. I guess he clarified that. So I think that's settled. The second is the length of closure. There was some debate over whether it's 24 hours or not. I saw different language in the material I read from the Mass DPH, but I would say it should be a mandatory 24-hour closure of a restaurant with a COVID-19 positive worker, and then they deep clean before they open. That way it's uniform and it can't look like one place is being favored over another. And I've seen that language in some of the literature from the Mass DPH and not in other places. But, and I don't know if we need to vote on that or what Bob thinks about that.
I don't think we need to vote on it because it's embodied in the code.
Yeah, that
that
language is already in the restaurant standards.
Yeah.
And it says specifically, in the event of a presumptive or actual positive COVID-19 case of a worker, patron, or vendor, the restaurant must be immediately shut down for 24 hours and then must be deep cleaned and disinfected in accordance with CDC guidance before reopening. So we've already had the internal discussion here. That is the protocol that we will be following.
Good.
Okay, that's great for me. Thank you.
Is that it, Noble, for right now?
Yes.
Thank you.
On those issues.
Okay, on those issues. Now let's talk about the follow-up testing or the value or the merits of follow-up testing. This is an issue that I personally have been thinking about since, our past meetings. And I've actually tried to get pricing on testing. But what I'm discovering is testing for COVID is complicated. There's multiple tests methods. There's multiple testing locations. There's multiple requirements and rules on whether or not you need a doctor's prescription to have a test run or whether you just want to have a test for your own reasons. And then there's all varying degrees of delay between the taking of the test sample and the return of the results. And I think some of it relates to the nature of the test that you're talking about. Is it an antigen test? Is it an antibody test? Is it a PCR test? So when I started playing around with the idea of trying to develop a standard testing protocol for restaurants after having a positive, I got bogged down in that. I didn't see a clear answer. But when I think about the public's protection from a newly identified COVID, I think there's 3 tiers of protection or three groups of employees in a restaurant. The first is the index case, right? So by virtue of identifying a new case and having that case removed from the restaurant and isolated at home, you're immediately protecting the public health at that point. Then through the identification of the close contacts of that index case within that restaurant setting, you're then identifying those employees and they're being required to quarantine for 14 days out of the restaurant. So I think if we rely on that as the basic public health protection protocol, I think patrons should be pretty well protected. The only testing you would bring to a restaurant after a case would be on the remaining employees who are not believed to have been close contacts of the index case. And then you will factor in the cost, could be well over $100 per test, and the several day delay in getting results. I think the burden on the restaurant may be more than what you gain in terms of new information. So that's just where I was coming down. I'm open to further discussions about it. And I know that in the world of COVID testing, there are always new tests coming out and new announcements in the media routinely. But that's kind of where I am at right now in terms of mandatory testing within restaurants after having a positive. I'm not there yet. With that as some opening comments, I'd like to hear from other Board of Health members.
This is Noble. To follow up on your outline, the index case, and then the close contact cases, which first are identified by the restaurant and then later by the VNA nurse. But the close contacts identified by the restaurant, they all 14-day quarantine and are out of the restaurant. So I guess the first question I might ask is, what would testing of those employees who are all quarantining for 14 days add to the public health? I suppose you could say if half of those people were positive, you'd have a higher index of suspicion, but basically they're already quarantining and away from the public. Testing the remaining employees, that can be a large number for some restaurants. And these are people who haven't been in contact, they're asymptomatic. I think that's a big additional jump in what mandate. And then I think you get into the issue of how far you are going beyond the Massachusetts guidelines. And that would be the issue there. So I'm basically thinking along the same lines as John.
What other board members want to offer? Any other ideas? I believe that widespread testing is a key to surveillance and control of the COVID illness. And if somebody were to tell me that there were newly available $10 home tests for COVID that you could do quickly and were reliable, my opinion on a lot of these policy questions would change. But we don't have that yet. And maybe there's a way to do more research, and maybe Judy could work with the board and try and create a summary of available testing sites that we currently know about and what the expenses are and what the turnaround times are and what's the nature of the test. And we could consider it further. But Ron, do you have any comments, or Dr. Ward or Ed?
Alan, I don't have any added comments, no.
This is Noble again. Yeah, I think that maybe we can ask for, more guidance from health department people, and maybe even the council weigh in on how far we can go reasonably, but get more information about costs, and I think Bob has already told us that other towns aren't doing this. And then gather information, and we could put it on the agenda again for our next meeting to rediscuss the whole testing issue.
I'm open to that if the other board members would like to, or Judy, would you be in a position to help us round up kind of a summary of what we currently understand about testing opportunities out there and the criteria that go with them, whether you need a doctor's prescription or whether it can just be self-referral, whether insurance covers it or doesn't cover it, or what the turnaround time is on it. Could you kind of help us develop some kind of summary table?
Sure.
John?
Mm-hmm.
Yeah, I mean, I was just going to say a lot of your questions we already somewhat know the answers to.
Okay.
Testing of symptomatic individuals, people that have already expressed symptoms, that's relatively easy. You just, in general, you need a doctor's script, and then you can go and get tested. And generally, in those cases, insurance will cover the test. Where it becomes a lot muddier is testing of asymptomatic individuals. So, the general population. If you just say, okay, I want to go get tested for COVID tomorrow, not every place will test you. Generally, you end up having to go to, one of the private commercial laboratories that will do it. And generally, in those cases, a lot of insurance companies will not cover it. So it's an out-of-pocket expense. Right now on the Cape, one of the places that we know of that does, say, the PCR test, it's $150 for the test. And you're right, there are cheaper tests out there, but they are nowhere near as specific, and they're not as accurate. So, we have a lot of discussion pretty much twice a week on our conference calls with DPH. There's discussions about testing and accuracy and cost and, those kinds of things. So, I mean, that's kind of where it is now. Nobody has yet come out with the, okay, I've got a perfect test that only takes 15 minutes and costs $5. There's a couple of tests out there. They're starting to head in that direction, but they're not there yet. So, I mean, just, we can certainly pull together some more specifics, but that's kind of where the testing environment is. The schools of the Mass Department of Education has set up a rapid response testing unit specific to schools that if they have a case, they can request. But even they have certain criteria, in terms of the number of people that have to be positive and things like that before, they will respond, recognizing that there aren't enough resources to cover everybody in the Commonwealth. So anyway, Judy can certainly chime in with more information.
Well,
I mean, I totally agree. I mean, I can put together a list of, what is available on the Cape, what kind of test it is, and what the cost is. But I think, everything that Bob said is totally true. And, the health agents and the county have talked and tried to talk to the state about the availability of more testing down here for the general public. But we're just not in an area with enough community spread, which is a good thing for the state to warrant that. Even though we went into the red zone for a week, it would take a lot more than that for the state to make available the type of testing that they're making that they're providing in some of our more urban areas off Cape. So, and I totally agree with what Noble said. You know, we're taking these close contacts out of the restaurants and they're quarantined. Even if they get tested, they still need to be quarantined for 14 days, as we discussed earlier. So, you know, getting a test that might not be reliable is not really all that helpful. What's really helpful is to keep them out of the restaurant for the quarantine period when they would possibly be infectious.
Right.
So,
Hi, good and fair points, Judy and Bob, both. Thank you. Do we want, anybody from the public want to comment on this separate question? The public policy
yes.
on testing?
Elaine Gibbs.
Go ahead, Elaine.
Yeah, I first want to point out that the town was acted very swiftly to make sure that all the firefighters were tested, even though there was no particular close contact or symptomatic people. Dining is far more intimate than that. I also think that close contact, anybody who has close contact, their insurance companies are going to pay. You call your doctor and said, I was in close contact with a COVID patient, and I think that's one of the criteria where insurance companies would pay. And I think the third situation is you're asymptomatic, but you are in an environment like a restaurant, and if that's the case, I think the employer probably should pay for it. I don't want to pick on the Squire, but I think it was a teachable moment. And that's why I'm a little frustrated here in that the first case was on a Sunday that was tested positive Sunday night. They closed overnight, but they opened for lunch and dinner. What the restaurant attendees, the patrons did not know is that there were 15 people being tested. Those 15 people were either symptomatic or close contact. They found out later at the end of the day that 3 of them tested positive. So then you're in a position where now you have a new index. You have 3 more new people. They had to go to them and say, okay, perhaps who were you in close contact with? It could be they were in close contact with the servers who were not in close contact with the first person. And it is a snowballing effect. And so then they closed for a day or two, and then they opened on Thursday and Friday. And Friday, there were 3 more positive tests, 3 new indexes that you then have to trace to see who they were in contact with. So
Right.
I think what I would like to see happen is that first of all, they did not shut down for 24 hours. They have to do it. I absolutely agree that has to be done. But if there are pending tests because of close contact, you can't open the restaurant until those results are in, because you don't know who the new positives will have been in contact with. And I would also point out that it's, the 6 feet, 15-minute rule is great for walking down the street, going into clothing stores and that kind of thing. Restaurants are really different. The CDC says that COVID remains on surfaces and objects for hours or days. And the Cleveland Clinic said it remains on glass for 5 days, wood for 4 days, plastic and stainless for 3 days. And the problem is servers who are asymptomatic, who may have it, are setting tables, they are handling this dishware, they are delivering food, and then the patron picks it up. And that's the reality of it. It can be, if the person is asymptomatic, they're young and basically healthy, but they're waiting on table and they have it, and they are, touching dishes, we won't know that until it's too late. So one of 2 things has to happen. Either you shut the restaurant down and all employees get tested, or you put a sign on the restaurant that there is a COVID cluster or that there are people being tested so that the patrons know, the public's right to know that they were eating in a restaurant where there were tests pending that turned out to be positive and they didn't know it. I think opens up the town to far more liability than would be potentially someone finding out by mistake an employee's identification under HIPAA. And if we don't do that, and we have another cluster going into the winter, because there is a sense that once we get into a closed-in environment, it's going to get far worse. And the fact that restaurants, you know, some of the reasoning was, well, they were only doing outdoor dining at the end of the week. If it's passed on silverware and glassware, outdoor dining means nothing if they're asymptomatic. So I hope that the Board of Health has broad authority. Costello said that. You have broad authority. This is not anything new. Boards of Health shut down restaurants all the time for salmonella and other things. And I think the restaurant has an option. They can either do it themselves or the Board of Health will do it. Or you put up a sign that says this is a COVID cluster. And as one of the selectmen suggested, we don't have to eat in the restaurants. It's our decision. Buyer beware, eat at your own risk, which I think is the wrong attitude for Chatham. I think that the Board of Health's only responsibility is to the health of the public, not to the businesses and worrying about the cost of tests. That will take care of itself. That can be figured out. The most important thing is to make sure that the public knows what they're walking into. We have to be able to trust that information. That's it. Thank you very much.
Thank you, Elaine. Anyone else from the community want to weigh in with their feelings or their opinions? Well, I kind of like what Noble said before. I would agree that we request from Judy some summary information on we educate ourselves to another level as board members on testing opportunities and costs and requirements readily available now, and that we carry this agenda item to a future meeting after we have that summary information available to us. But I don't think we ought to do anything beyond that at this point in time. Everybody okay with that?
Noble, yeah. Yeah, I did have one question of Bob, and that is, does the town know of, and we may not be aware of all, but does the town know of any patron in a restaurant in Chatham that has come down with COVID?
I think we may have one that indicated they had eaten in a restaurant. I'd have to go back and I'd have to double check. But I think I saw that in one of the notes section for one of our cases. But we could double check that and confirm it for you.
Yeah.
You know, the other comment is that I'd like to make is we did get that interesting CDC report that was very generalized about the idea that individuals who had been diagnosed with COVID had a higher history of having recently eaten at food establishments than non-cases. But that was it correlated. I don't think there's any details about, well, how did they get infected, or was this indoor or outdoor dining? But I think as we learn more about what actually are the risks of restaurants to diners, I think we'll be guided more by that. I mean, the risk of getting infected could be sitting next to a table of other people who are unmasked. It may have nothing to do at all with the restaurant staff, but you can speculate. But it's certainly an area where we need to understand more, not less. So in terms of other board members, are you okay with where we're at on this? Kind of parking this testing policy question to a further meeting and getting additional summary information from staff.
Ed Sheehan, yes.
Alan, yes.
Okay.
Yeah, and Noble, yes. I would just say one other thing to think about. If we do something that forces a restaurant or a business restaurant to stay closed for a number of days, I think that goes significantly beyond what the Mass DPH guidelines are. And then we have to think about that and be a little more cautious. And I think Attorney Costello talked about that.
He certainly did. Okay. Are there any other topics relating to COVID-19, Board of Health issues that anybody would like to raise at this point? If not, I think we've covered the ground, at least that I thought we wanted to cover tonight.
Hey, John?
Yes, Bob?
Yeah, Elaine Gibbs still has her hand up. I don't know if that's new or just leftover.
It
Were you
was
done,
left.
Elaine?
It was left over, but I would like to say that the Board of Health, you are an autonomous group. In this situation with the pandemic, you're the final authority. And I think that you should not be as concerned about businesses. That's somebody else's responsibility, or exceeding your authority, because these are unprecedented times and we don't want another cluster. So I hope you will vote on the side of being conservative and making sure that the public is advised of what's going on, and that we have full information, and that you do everything possible to get as many people tested as possible so this thing does not spread. And we're not going to hear about patrons because 90% of them leave and go to other states. So we're not going to know if patrons are getting sick, and they're not going to know where they got it from because we're not calling them.
Well, they could have eaten out several places. So, okay, thank you, Elaine. If there's no other business to be raised tonight, I would welcome a motion to adjourn.
Motion to adjourn.
Do I have a second?
Second, Alan.
John, do you have minutes in your packet?
Ooh, yeah, I think, do we? Actually, we do.
Yeah.
Thank you, Judy. I gotta find mine.
They're the minutes from September 14th.
Okay.
Yes, I've got them. Thank you. Are there any edits or comments or changes that any Board of Health members would like to recommend be made in the September 14th minutes? Hearing none, can I have a motion to accept the minutes of September 14th?
Motion to accept. Ed
From Ed.
Sheehan.
From Ed, do we have a second?
Noble, second.
Okay, all in favor, when I call your name, please announce how you'd like to vote on the motion to accept the minutes. Dr. Hanson,
Accept.
Dr. Ward. Oh, Alan was not here at the time. Ed Sheehan,
Here.
and I vote yes. So we have the 3 votes to approve the minutes. And I don't know what happened to Ron Broman. I guess we lost him a while back on the meeting. So that the minutes should, for this meeting, should reflect that we did lose Ron at some point. Okay, now a motion to adjourn the meeting. I think we had a motion from Ed.
Yep.
Did we have a second to adjourn? Can I get a second to adjourn?
Second, Noble.
Okay. When I call your name, please indicate how you vote on the motion to adjourn. Dr. Hanson,
Approve.
Dr. Ward, Ed Sheehan,
Here. Present.
and I vote to adjourn. Okay, so we have a motion to, so that means the meeting is adjourned for now. Thank you, everyone who was on the call and contributed, and anyone who was on just listening. And thank you for staff and for the Board of Health members for their time. Thank you. Good night, everyone.
Thank you.